Tonight, the effects of the COVID-19 pandemic continue to be felt in public institutions, some of them forced to temporarily close down. Now, the month of November has defined itself as the worst in the fight against the pandemic, whose tally now is above 72,000 infections. Since the much-celebrated reopening of the economy 1.5 months ago, the number of infections and deaths have almost doubled, leaving the country uncertain of what the future holds. We're going to begin our broadcast with our very own Sam Gituku, who looks into the numbers that tell the dark story of a lacking health sector unable to keep its citizens alive, or at least healthy.
The COVID-19 pandemic continues to wreak havoc in many homes and families across the country. Hundreds struggling to afford the much-needed healthcare for their sick. But the rising death toll is becoming a bother, punching what was once seen as a passing cloud. In the latest statistics, 957 people have tested positive from a pool of 6,309 samples analyzed. A positivity rate of 15%, consistent with the incessant pandemic. 11 people have succumbed to the virus. This pushing the total caseload to 72,686 infections from 804,000 samples so far tested. The death toll is now at 1,313, with the recoveries standing at 68%. The rising death toll now a matter of concern. Over the past 51 days since reopening of the economy on the 20th of September, a total of 613 deaths have been reported. During the same period, over 34,000 infections have been detected, a number that almost doubles the caseload before reopening. And with the reopening, COVID-19 transmission has been noted to head to the counties, with 9 counties now recording more than 1,500 infections each. Nairobi, for instance, has recorded over 11,000 new infections, Mombasa more than 3,700, Nakuru more than 2,500, while Kiambu has recorded a spike of 1,872 new infections. This raising the totals to over 32,000 in Nairobi, 6,632 in Mombasa, 4,588 in Kiambu, while Nakuru now has 3,666 infections recorded. And the numbers continue to rise in the rest of the counties, some having senior government officials affected, forcing closure in some of the institutions, like in Kakamega, Nandi, Meru and Kirinyaga. Kirinyaga County has shut down its county assembly days after similar actions to different government departments. In the monthly outlook, November's numbers are said to be a record high. In just 18 days, 17,494 new infections have been recorded, an average of 971 per day. And as the infection rate rises, so is the death rate. In the same period, 317 deaths have been reported from COVID-19 complications, many losing the battle while being treated at ICU facilities. And with the positivity rate remaining high, there appears to be no let-up in the horizon. A month that on average has had a positivity rate of 15.9%, pushing the focus on the healthcare system, which is on the verge of being overrun. A report of the Senate Ad Hoc Committee showing the inadequacy of the county health facilities, lacking in oxygen support services and ICU facilities. At the moment, 1,191 patients are admitted across different hospitals. 31 of them are in ICU. 115 are on supplemental oxygen in different wards, including general wards. 27 patients are under the aid of ventilators. Over 2,000 patients are under the home-based care. Health Acting Director General Patrick Omoth saying it would cost 21,000 shillings to care for a patient with mild symptoms at home. The cost could go as high as 71,000 shillings per day for ICU patients. But those